Is a COVID-19 booster shot needed? Vaccine effectiveness against SARS-CoV-2 infection and mild COVID-19 disease provided by the standard number of primary vaccine doses declines over time, while protection against severe disease and death remains high, including against the Omicron variant. A booster vaccine dose can significantly restore immune responses, particularly in older adults. Vaccine effectiveness studies for a booster dose are published by an increasing number of countries but remain limited in follow-up time. All studies demonstrate an improvement in protection against severe disease and death. WHO recommends that countries offering a booster dose should focus first on the most vulnerable groups and healthcare workers to minimize the risk of increased severe cases and deaths and maximize the resilience of healthcare services.